Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning in to the latest edition of The Checkup. About a year ago, CHI Franciscan opened a mission control center that relied heavily on artificial intelligence to help drive decision-making. And at the time, Ketul Patel, who's the CEO of the system, probably didn't realize just how valuable that mission control center was going to be in the use of artificial intelligence in managing a pandemic. I'm pleased to welcome Ketul, who is also president of the Pacific Northwest Division of CommonSpirit Health. Ketul, thanks for being with us today.
Matt, good to see you. Thanks for having me.
Absolutely. So as I said, you guys opened a mission control center about a year ago, I think August of 2019. I know you wrote about that a little bit and talked about it in previous issues of Modern Healthcare. And at the time, you probably didn't realize how are you going to utilize that in terms of a pandemic. But talk a little bit about that center and what lessons you've learned from it and how are you utilizing it now in the pandemic.
Matt, it's a fascinating story. Just going back a year ago where I think life for all of us was so different, we were planning to use a mission control to really help us manage our occupancy. The Franciscan system that has over 1,300 beds was truly struggling because our occupancy continued to be at record highs. In fact, we had two of our campuses that were consistently over 100%, which is, certainly we provide great patient care, but it's not the best experience that we want our patients to see. So we partnered with GE Healthcare to be one of only 5 systems around the country to really set up mission control. And really one of the primary reasons for that at the time was to manage flow and capacity and truly predict how that flow of capacity based on historical knowledge was going to help us plan for the future when it came to not only bed capacity, but also staffing reasons, making sure that we have the right physicians involved from an intensivist perspective in terms of acuity, et cetera. But who would have thought after all this time that we would be ramping up for what's happened with the pandemic? And just a little bit of background for you, Matt. I think most of the viewers likely know that Seattle became the first hotspot in the country. We actually stood up our mission control and our command center in preparation for all this in January, knowing what was happening and certainly in China, assuming that at some point it was going to come here. So we had a couple months to plan, but I think when we saw our first case, which happened to be on February 29th, nobody was ready for that. And I think as all of us know now, there was so much misinformation. Guidance continued to evolve with the CDC and other parts of the country were certainly getting the kind of fear that we were starting to see. So it was a great opportunity for us, having had a few months of the Mission Control Center up and running, to really put this into practice in different ways. I'll give you 2 very, very specific examples. Early on, one of our campuses, St. Anne Hospital, which is in the shadows of Seattle, started seeing patients from, if you remember the nursing home in Kirkland that was really at the epicenter of what was going on. We saw a few patients coming from that nursing home, and from that we started to see spikes. St. Anne historically has had quite a number of beds available. We started to see record highs of occupancy on that campus, and allowed us to really start looking at other parts of our system to see where could we potentially take care of patients if we started to see a surge continue on from where we were at that point. So it's been great for us. It also allowed us to bond further as a regional system here in Tacoma. It allowed us to really communicate exponentially, where historically we relied on a lot of phone calls and discussion that was going on. Now everybody had things at their fingertips happening all throughout Franciscan at the time.
And so as you think about how you've evolved with Washington is sort of flatlined and I think coming down, right?
Yes.
How are you using the lessons you learned from the early stages of this spike to now and continuing to develop your use of artificial intelligence?
So, as you know, Matt, we're part of CommonSpirit Health, and I think we're extremely lucky to be part of a national health system. Many things that we were able to really be set up for where other hospitals, certainly in this area and others around the country, were struggling with. Things like our supply chain or our PPE. We're in very good supplies, if you will. We spent a lot of time early on making sure that all of our necessities, if you will, were ready to go. So we were we were in a good place. The realities for us, as we started to see the spikes, the biggest issue, and it certainly has been around the country, has been testing. And I think testing, we've all struggled. A few other points for you, for me to share, just to give you an idea. We have over 200 medical clinics around the Puget Sound in this region. We saw about 28,000 visits per week. At the height of COVID, which was in April, we in essence saw 45% less. We were at the time, early on before COVID started, our virtual capacity was at about 1%. We were seeing 1% of those 28,000 patients in a virtual setting. That has now increased exponentially, certainly over the time that the pandemic was at its height, where about 15 to 20% of our cases were virtual. We're going to continue to see that move on. I think one of the things that we're looking at now is coming out of this. Are we going to continue to need all the 200 plus clinic sites that we have? Because we're starting to see now that certainly our consumers and patients have had the opportunity to have virtual visits. They're getting more accustomed to it. Our life is going to change, and we're going to certainly be part of that.
So cool. We recently just opened a new family medical clinic as part of the chain. So how does that, I know that the strategy for building that started pre-COVID, but you've recently opened it. So how does that factor into the equation?
Well, Franciscan, and certainly the Pacific Northwest division of CommonSpirit was growing. It was a growing division within CommonSpirit. And so we had a lot of strategic priorities that were built around growth. We have 5 regions within the Pacific Northwest, 3 in the state of Washington and 2 in Oregon. Our 3 locations in Washington, and I'd share them with you in this way. One is in the South King region, which is in the shadows of Seattle. The second one, in the primary location, if you will, is in Pierce County, which is the houses of the Tacoma community. And last is the Kitsap community in the Olympic Peninsula, where we're not only opening up our family medical practice clinic, but we're also expanding our Silverdale location with about a $500 million project to open up a brand new bed that's truly spectacular. It is in the shadows of the Olympic Mountains. Every patient room has views of the Olympic Mountains, and these are projects that we've had ongoing now for the last couple of years. The one you talk about, we actually kicked off in 2017, and with a family medicine residency program. We now have 3 classes that are coming through of residents, if you will. We'll be graduating our first residents in 2021. So it's a lot of exciting time for us. But that's actually not been the only thing that we've grown within the Franciscan system. Several years ago, in 2016, I think you've written about it in Modern Healthcare. We partnered with Virginia Mason and signed a strategic affiliation and clinical alliance. It was a tremendous opportunity for us at Franciscan. We've always been enamored by Virginia Mason's quality, patient safety, and patient experience outcomes. We within Franciscan, in particular, when I got here, our quality scores needed to improve, and now we are the only system in the state that boasts all A's and B's. In fact, our 2 B's in Leapfrog are very close to being A's, and that's something that we're extremely excited about.
So let's sort of stick on that strategic planning and growth for the remainder of 2020, which who knows what that's going to be, but certainly 2021. And we had Marvin O'Quinn, the COO of CommonSpirit, on recently. How does the rethinking and recalibrating your strategic plan take place while there's still so much uncertainty around what the remainder of this year is even going to look like, both from the pandemic and financially?
Sure. So much of what we were doing in the Pacific Northwest, just again, as I mentioned about occupancy, was driven around inpatient strategy. We needed beds. The population in this community was growing significantly. I think with this pandemic, everything has changed. I touched on virtual capacity, but certainly the population growth is something that we have to keep an eye on. Seattle and the regions around Seattle were growing. It was one of the fastest growing cities in the country, if you recall, Matt, just before COVID hit us. I think now we have to take a very hard pause, which we're all doing. It helps us being part of CommonSpirit because many independent hospitals are struggling, but they're struggling on their own. Whereas, one of the benefits of us, and you look at CommonSpirit as a whole, the pandemic spread around the country, and also spread around CommonSpirit. We were the first in the country. Then it scaled to Southern California, and then went around the country. And so when markets around CommonSpirit were spiking, there's other markets like Nebraska that have truly not seen the pandemic hit. So for us, it allows us to be certainly sustainable for a very long period of time. Our financials, even though we've been hit very hard through the pandemic, we have a very good forecast for us in the future. And so we're taking a hard pause in terms of our strategy. Some of the plans that we had in place, particularly at Franciscan, around projects to expand St. Joe's Medical Center and St. Francis Medical Center, are going to be put on hold. We're going to take a hard look to see, do we now need to do a lot more virtual? Do we need to do a lot more in an ambulatory setting with a lot smaller footprint, et cetera? Those are the type of things that we're going to be taking a hard look at right now.
And how long does that hard look last? Do you have that mapped out?
Well, we do have a roadmap. It's certainly going to take us through the summer. There's projects already in flight, as I'd call them, that we've already taken a look at to see does it make sense. And the one you referenced with our family medicine clinic was certainly part of that. Or we have the joint venture with Virginia Mason for OB, which we actually are going to be opening up in August. So there's projects that are in flight. We took a long, hard look at, and we continue to progress on those. There's others, as I mentioned, that through the summer, we're certainly going to spend the time to make sure these are the right ones or wrong one. I think all of us in healthcare in the fall, or wherever your planning cycle is, are going to come out with new strategies that really are going to take us past this calendar year.
Sure. Lastly, Ketul, I want to ask, as we've talked to part of CommonSpirit, we had Marvin O'Quinn on, as I said recently. You guys were through the beginning phases of this in Washington State. Yeah. What kind of lessons are you sharing with your colleagues in Arizona and Texas and elsewhere across the CommonSpirit network, who are now really being hit hard with a surge, both the surge, but also they're dealing with trying to reopen the economy and staff morale and burnout and things that maybe you didn't have to deal with as dramatically?
Yeah, and this is again the benefit of being part of a national system that covers a number of states that we do. One of the first things that Marvin did, and I have to tell you, I am just absolutely in awe of his leadership. Certainly coming into this, but spending the time that we have through March and April and May and June with him as our leader. He actually has 2 calls per week with all of our division presidents, and part of those calls is to talk about what's happening within each of our divisions, share some of the practices that we have learned, talk about needs in terms of supplies and certainly testing. And because of the fact that we do have scale, it gives him the opportunity to say, we have Arizona spiking, we have Texas spiking, we have LA spiking, which is actually what's happening now. And should we now redirect some of the testing that we need into those markets? When we talk as a family, if you remember, CommonSpirit is at the time when the pandemic came out, was less than a year old. And this has really driven us to mature as a health system. Lloyd Dean, who's now our single CEO, has just been tremendous in his strength of making sure that we have the resources that we need. Communication is certainly at a premium. I can't say enough that both of our national leaders have actually zoomed into several of my board phone calls and Zoom calls just to talk about what's going on around the country. So one of the singular lessons that we have learned is communication is absolutely key. We found that here within Franciscan, and even more so being part of the family. I used to get calls daily from my colleagues in Texas and LA, and as we were starting to surge, to just find out what we were doing, how we were dealing with it, what have we learned as we moved the pandemic higher in terms of the volume that we had here.
Yeah. I know I said that, but this is really the last one. So
okay.
I can ask kind of a financial question.
Sure.
As it relates to telehealth, which, as you referenced and other folks have referenced, is potentially here to stay.
Yes.
But as the CMS potentially rolls back some of the relaxations of their rules once the national emergency goes away, we're not sure yet what states and some insurers are going to do.
Right.
What's your message to policymakers and payers in terms of the need for flexibility to keep telemedicine going forward?
Right. The beauty, as I hope to see out of this, is that hopefully many of our policymakers I've had family members that have utilized virtual care, and I think that's an important part of all this is familiarity. One of the things that we found, as I mentioned earlier, is that the technology concern or gap that many patients had was taken away very quickly because of true need. And to my message to our policy leaders is very simple. We know healthcare is changing. We've talked about the evolution of healthcare and driving things outside of hospital for my entire career. And my hope is that this pandemic truly drives our policymakers to really think about reimbursement models that help us do that. The more we keep patients out of the hospital, the better it is for all of us. The more we can truly impact the cost curve, not only regionally, but nationally. And that's truly my message to our policymakers at the time.
Well, great. Ketul, we appreciate you taking some time. I know you got a busy schedule, so thank you so much.
Matt, good to be with you, and thank you very much.
Thanks. And I'm Matthew Weinstock. That's it for this edition of The Checkup. Be sure to come back next Monday. Stay safe, everyone.